across major social media platforms such as TikTok and YouTube. A wide variety of viral videos about how to effectively whiten your teeth at home, safely remove stubborn tartar, find much cheaper veneers, or even how to file down your own teeth are currently racking up and capturing the attention of many millions of viewers worldwide. But the problem is that after following some of this advice, you end up not whitening your teeth but having to treat them, and in some cases even have them removed. Today I'll break down popular viral dental trends, from relatively safe ones to those you should never try. And believe me, some trends look much more harmless than they actually are.
Applying my white strips. Make sure your teeth are dry. Fold them over so they stay in place.
In this video we see whitening strips being used. In fact, they come not only in the form of strips, they can also be gels, pastes, or even special trays with this kind of formula. As for whitening, whitening is one of the most popular searches on the internet. The principle behind whitening is very simple. All whitening products are based on hydrogen peroxide or active hydrogen, and it's very similar, almost identical to hair bleaching. Women often do this, but men can too. That is, the hydrogen displaces this pigment or color. What is pigment? Basically, it's a food coloring from coffee, from tea, from red wine. In other words, when we consume certain foods, the enamel has the ability to absorb this kind of stain, and our teeth become yellow or even turn black. And accordingly, it's impossible to simply clean this off because the pigment itself is already deep within the enamel. It can only be displaced. And so, thanks to oxygen, let's imagine little hydrogen bubbles, they actually push out this pigment, and as a result, our teeth become whiter. What can I say about these strips? Honestly, I have a negative attitude toward them. Why? Because even in my own practice, we refuse a large number of patients who come to us for whitening, because it's very important to look at the actual condition of the enamel. Sometimes a patient has very weak enamel. For them, not only is whitening forbidden, but they actually need to restore it first. And whitening isn't even an option, even though the patient wants it. So if we do whitening for a patient just because they want it, not only will we damage the enamel, but we could ruin it so irreversibly that the only solution left would be crown. That's why you have to be very careful with whitening. If you still decide to whiten your teeth at home on your own, the first recommendation is to definitely get a professional dental cleaning from your dentist. If that's not possible, then at least make sure to brush your teeth thoroughly before the procedure. Why is this necessary? It's necessary so that the whitening agent can penetrate your enamel more quickly, because if there's plaque, it will be much harder for it to work effectively. And secondly, you might end up with uneven whitening precisely because of the plaque. This film that covers our teeth after any meal is very dense and, let's say, prevents the whitening agents from penetrating. That's why you must remove it, so there's nothing blocking the whitening agent, and then your teeth will whiten as evenly as possible, allowing you to achieve the result you want. So, is it actually okay to use these strips or not? I'm still against using such strips. They really are very dangerous. Some people say, "Bapastpom, everything is fine for me," but you don't see how many people actually end up damaging their teeth. That's why it's best to at least consult a doctor first. You don't necessarily have to do it in a dentist's chair, just at least get a consultation to see if it's suitable for your mom, for example. What could happen to my teeth? How could I damage them with these strips? The first thing you'll get from this kind of, let's call it DIY teeth whitening, is hypersensitivity, at the very least. Your teeth will react to cold, hot, even to breathing. If you inhale, you'll instantly feel intense pain. And it can even get to the point, we've had patients like this, where they get a burn on the mucous membrane. So besides applying the product to their teeth, it also gets on their gums. Just imagine how delicate the gums are. And people actually come in with chemical burns on their gums. So when we do whitening, if anyone has ever had it done, maybe you've seen, we use a special material called liquid cofferdam to protect the gums. That is, we first cover the gums with a special protective compound, and only then do we proceed. Imagine, even in a dental clinic, only then do we do the whitening, just to make sure that, God forbid, the product doesn't get on the mucous membrane. Plus, the assistant uses a saliva ejector to control and collect saliva so that nothing drips onto the tongue or the patient doesn't accidentally swallow anything.
तो मैंने भी अपना टूथब्रश उठाया, उसमें थोड़ा सा पाउडर लगाया एंड स्टार्ट ब्रशिंग माय टीथ. पहले तो उसका टेस्ट बहुत ज्यादा गंदा था और ब्रश करते 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 मैंने जब अपने दांतों को देखा, आई वाज टोटली शॉक्ड. पूरे के पूरे मेरे दांत काले हो चुके थे, मेरा ब्रश भी पूरा काला हो गया था. इसके बाद मैंने इसे अपने दांतों में ऐसे ही 5 मिनट के लिए छोड़ दिया एंड रिंस करने के बाद अब बारी है फाइनल ट्रूथ की. भाई फर्क 30 to 40% येलोनेस कम हुई है, बट अगर मैं इसको रोज यूज करता गया तो डेफिनेटली ये काम करे.
The second trend from the internet is charcoal toothpaste. Actually, it's kind of an old-fashioned method. If we go deep into history, in the past there was nothing to brush your teeth with. People really used to brush their teeth with ash or charcoal. Of course, it wasn't coal from mines, but specifically wood charcoal. They even used it to clean dishes like silverware and ceramics because there was nothing else available. The principle here is very simple. It's a typical abrasive. It's literally an abrasive that grinds down tiny particles, which are simply worn away by this mechanical method. An abrasive is a substance that allows us to rub, erase, or polish something. So these are microgranules or fibers. Basically, it can be anything. Anything related to polishing when we need to clean something, that's when abrasives are used. Or to scrape something off. This is the principle of abrasives, at home, in industry, or even just cleaning dishes at home. You need something fine, like sand. You know how we use sand when we're out in nature, like when we wash dishes outdoors? Or a pot. Those who like fishing or hunting, how do we clean it after a trip? The pot is all black, covered in soot because we've been cooking in it for 2 days. You go to the riverbank, grab some sand, and that's your abrasive. It's what helps mechanically remove residue or dirt. It's actually a good method, but you have to be very, very careful. Any mechanical impact on your teeth, you can try it once, but repeating it, or God forbid, doing it every day, I strongly urge you not to do that. Give it a try once a month and observe the results for yourself. You will almost certainly notice a significant difference. But make sure to remain as cautious as you can. If you tried it, check the result, and it didn't work, it's best not to try again. But if you keep chasing the effect, like it didn't work for me, I'll do it again and then again tomorrow, then it's all very simple and obvious. We'll just mechanically scrape off, clean off, or even wear away our enamel completely. You can try pure water abrasive once. Still, I wouldn't recommend this method. And if I were to recommend it, only after consulting a dentist.
A white smile, that's everything. It shows that you're hygienic and makes you look more attractive. To achieve this, take a little baking soda. Take some powder, add some water, make powder, and it should look powdery like powder. Do you see this consistency? This is what we are looking for. Powder. Take a block and climb in there. You should do this after you brush your teeth. Do this in circular motions, just like when you brush your teeth. Do this for about 30 seconds to 1 minute.
The next trend, the most common in the world, is baking soda and lemon juice, or lemon. It's just a miracle worker, a magician that supposedly whitens teeth right away. All of this too, unfortunately or fortunately, came to us from some kind of household tradition back when there really weren't any toothpastes yet, when everything was just developing and people wanted to clean and whiten their teeth somehow. And that's why this method exists. It is very similar to the previous method where charcoal is used. The principle here is exactly the same. First, there's baking soda, which has this abrasive effect. Here, it's just plain water. And then citric acid, which supposedly should dissolve tartar and plaque. In reality, this does not happen. I really don't see any need to use lemon juice or lemon as well. Baking soda alone is enough. The principle here is the same, just like in the video where it's shown how someone brushes their teeth with baking soda. You can try it once. Anyone who has brushed their teeth with baking soda will definitely say that you immediately feel, especially if you start brushing closer to the gums, that the gums start to react. There's a tingling sensation. You feel a burning in the gums. This is exactly the kind of aggressive effect we're talking about. But let's put it this way. You can try it once just to understand what it's like, but you absolutely should not get carried away with using baking soda. This is not the tool or the substance you should use to whiten your teeth. Try it once for yourself to understand, and that's enough. But I definitely wouldn't use baking soda. It's actually very dangerous.
Now let's swish some coconut oil. Ugh, I'm going to be unbiased. 1 minute, like gum. Coconut oil. Ugh. Gee, imagine that. My teeth are still dirty. Looks like chewing gum wins.
Trend from the internet. Why am I actually smiling right now? I think this is honestly the most useless trend of all. I see it not only all over, let's say, the whole world, the World Wide Web. It comes up very often in our Russian internet as well. I honestly don't understand how oil could affect whitening at all. By the way, you can write in the comments if anyone has tried it. I've even heard that people mention certain types of oil, like sesame oil or something else. Honestly, I just can't imagine how oil, when you put it in your mouth, is supposed to whiten your teeth. I just don't get it. Oil can definitely, certain types of oil like sea buckthorn oil and some other medicinal oils can really help heal gums when they're inflamed or injured. But as for oil whitening teeth, I've never come across that. That's why I consider this the most useless and incomprehensible type of whitening. The next trend is more like something from a dental laboratory. In other words, you already need to have the skills of a dental technician and even a prosthodontist. That's the kind of doctor who makes or fits dental prosthetics. It does have its place. I think especially since there are a number of patients, in my practice I've had such patients, who try to make themselves a temporary tooth using various improvised methods or materials like these. Most often this is needed as a temporary solution, like for an anniversary, a wedding, a photo shoot, or something like that. Some people try to patch it up with chewing gum, others use various kinds of compounds. And here, as you can see, there are these granules that are actually sold for this purpose. You heat them up, or rather, you immerse them in water, and they become soft like modeling clay. You can then mold yourself a tooth out of them, remove any excess while it's still soft, and then you just soak it in water and it becomes hard like a real tooth. And if you noticed, people even try to crack nuts or bite things with it. So as a temporary tooth replacement, when you really need something just for today for an event, in our experience, in my experience, we've had teachers or presenters who needed something like this, or people who had to give a speech. Yes, you could probably make it in the evening, cover the gap, and just go out in front of people. But chewing, biting, or walking around with such a tooth is definitely not recommended. As a temporary solution, yes, but be very careful not to swallow it. And most importantly, we don't know what it's made of. So you don't want to harm yourself chemically or get poisoned by something.
Bottoms. Tops. Bam.
This trend is one of the most interesting ones. It's interesting for several reasons. Reason number one. First of all, in this video, the patient has had these, let's call them, they're not veneers, they're more like crowns made. They are made from a special material, which we call PPMA. So now it's very easy to make them because we simply scan the teeth and then a special milling machine carves out these solid crowns with micron level precision. As you can see, it covers all the teeth. This is a kind of temporary solution. There are also various kits now sold on different marketplaces where you can do this yourself. You apply it, put it on, and even trim it yourself. But once again, in this video, you can clearly see that this was made by a dentist. Everything fits so perfectly and was finished so smoothly. From an aesthetic standpoint, if you also noticed how uneven the patient's teeth are, this is definitely a factor. So specifically when a patient doesn't want to undergo orthodontic treatment or take a comprehensive approach, yes, of course you can do it this way, but you need to clearly understand, first, this is purely a temporary solution. Again, just to go out in public, take photos, or attend an event. So it's strictly temporary, that's the first thing. Second, of course, it will be difficult to chew with such teeth. And most importantly, can you imagine the extra bulk in your mouth when we don't shave down the teeth and simply put something like this right over the old teeth? It might look in the video like, well, what's the big deal? The teeth just got a little bigger. But no, every millimeter, even half a millimeter, is very noticeable. Imagine if we made such teeth for both the upper and lower jaws. Not only would your mouth not close, it would close incorrectly, and you'd end up with a strange smile like this. But again, I have to say the aesthetic, cosmetic effect is enormous. You instantly look like a different person. Honestly, I'm also a supporter of naturalness. I believe a person should have some charisma, and yes, teeth are certainly an important part, no doubt. But there are some patients who say, I don't want to do anything with my teeth. And I support those patients too. But sometimes you want a bit of beauty. Why not? If you can find a doctor who can make you such a temporary construction, let's call them removable teeth, where you just put them on like this. If you remember, even as a child, or even now, you can buy those fake vampire teeth in children's stores. This is exactly the same thing. You can put them on, you can wear them, but it will be extremely uncomfortable.
So you're telling me that y'all are getting your veneers done by Veneer Tech with a certificate instead of a degree? What is a Veneer Tech?
There's another very interesting trend. The current growing trend that we are seeing is that people without any formal medical or dental education, acting simply as a type of self-taught craftsman who has somehow learned the trade, can now manufacture dental veneers or various prosthetic teeth, and do it quite freely in the market today. I want to state responsibly, and thank God in our country, I say this with full responsibility, this does not happen. Specifically in Russia. Of course, there are a number of countries, India, for example, or as it seems to me, countries that are, let's say, less developed or where there is simply less oversight in this area. And there are probably some people, I assure you, who go there because it's just cheaper. They're looking for a lower price, but I definitely would not risk entrusting such work, super precise, super meticulous, highly professional work that requires not only manual skills from the doctor or specialist, but of course, a foundation of basic medical education is essential so that the person understands what they are doing. That's why this trend does exist. It's actually a global phenomenon where people really do entrust their teeth to someone who is not a medical professional. But here, it's not widespread, so it's better not to do this and to seek medical help from qualified specialists. Another incredibly popular and widespread trend, which you can find all over YouTube, and especially across the Instagram platform. For some reason, it's commonly called Turkish veneers or Turkish teeth. I wouldn't want to offend our friendly country or associate this with any nationality or country. Of course not. It's more related to the fact that a lot of people from all over the world come specifically to Turkey because dental services are more affordable in Turkey. And logistically, it's just very convenient for people from all over the world to travel there. That's why, yes, Turkey is one of the most popular destinations in the world for dental tourism. That's why this trend was called Turkish veneers or Turkish teeth. But again, that's not really the case. Here we see typical veneers. Yes, here people might criticize them, saying that the teeth were supposedly ground down too much, or that they stand out in a vulgar way because of their bright white color. Some even jokingly call them toilet teeth. This has nothing to do with Turkey. You can get the same result in Russia or any other country. There are simply different techniques for tooth preparation. Some people grind down the teeth a lot, others do it. Of course, nowadays everything is moving toward what we call minimal preparation or minimal grinding of the tooth, because it's important to preserve as much of your own tooth tissue as possible so that the teeth under these crowns or veneers last longer. The trend is probably more about the fact that people just decided to call them Turkish teeth. And supposedly that's how veneers are made there. No, that's absolutely normal. It all depends on the doctor and the patient. If a patient chooses such a bright white color, well, what can you do? The patient decides what color to have. The doctor always shows the color palette and the patient makes the final decision. Another matter is that you have to decide for yourself whether you're ready to have your teeth ground down like that or not. But I would look for dental clinics and doctors who grind down the teeth less and preserve more of your natural tissue. Whether they end up super white or a bit grayish.
I am currently fixing the gap in my teeth with $5 clear rubber bands. These are the bands that I use. Here is the results of only 1 week.
This internet trend is putting rubber bands directly on your teeth. If we pay attention to this video, the patient has a diastema, which is the space between the front teeth. And supposedly, over the course of several weeks, the patient put on a rubber band and started moving the teeth closer together like this. First of all, this is possible due to physical force. Maybe not in 2 weeks, but in a month it can definitely be done. But correcting a bite is a very serious job. It's so complex. You really need to understand what's going on. With these rubber bands, you can definitely close that diastema, definitely. But what will happen to the other teeth? That space will appear somewhere else, you see. So if you close it here, it will show up between other teeth, and then you'll end up with 2 diastemas. It's not that I don't trust this method, but I would never do it that way. It's best to consult a specialist, an orthodontist. But the principle of any orthodontic treatment, any correction of teeth, is exactly this, absolutely right, just like in this video. That is, it's a kind of mechanical impact on the teeth, here in the form of rubber bands or braces or aligners, when we simply apply force to the teeth, literally physical force, which is why we pull them together or correct them. So in principle, this method exists, but it's better not to do it on your own. It really is very dangerous. The danger is, first of all, that you'll get gaps in other places, and secondly, you could simply change your bite, which could damage neighboring teeth. When you move teeth this way, even a ½ millimeter change, we're talking about the bite and about the lower teeth as well. You can't just change things in one spot and that's it. In the end, the opposing tooth might not align properly and your mouth might not close, or it might close incorrectly. You could start biting your cheek or tongue. In other words, every millimeter of change in the oral cavity can have very serious consequences. And finally, I specifically saved this for last because I personally have already seen this with some patients. I see a lot of videos about it, and I see it being sold all over marketplaces. It's just everywhere. In this video, if you notice, it's a real dental scaler or ultrasonic scaler. This is a special device that we use to remove tartar right in the dentist's chair. But here, they're offering it for regular people to buy, to turn on at home and use themselves. If you paid attention, the person even turns on the scaler and tries it on a metal object. If you look closely, it even squeaks. There's a high-pitched sound. That's the effect in action. And if we zoom in or slow down the scaler's movement, it makes a huge number of these motions per second. Just imagine, it's basically a jackhammer pure and simple, but you can't see it because the amplitude is so fast. That's why it's super dangerous. Don't risk it. Even the position of the tip affects how it impacts the teeth. If you turn it a certain way, you could actually chip or break your tooth. You even have to place it carefully at an angle, very gently. To give you a clear comparison, imagine we take a power drill and use it to remove tiles from a wall. If we use the drill carefully, the wall stays intact. But if we turn the drill this way and start removing tiles, we'll just punch a hole right through the wall. Here, the principle is almost exactly the same. That's why dental hygienists and dentists are trained to use the scaler properly. You also need to understand which areas to work on. You have to be extremely careful, absolutely careful, because it's very easy to damage the enamel with a scaler. It's truly a high-tech medical jackhammer. That's why I absolutely forbid you from using such a device at home, unless, of course, you're a dentist yourself. For a dentist, it's definitely fine to use it on themselves. And there are even dentists who not only clean their own teeth, but also extract and treat them themselves. So for a dentist, by all means, it's their responsibility. Let them clean their own teeth as they wish. But for someone who has never held a scaler, who doesn't understand the ergonomics, who doesn't know how to use it, I absolutely insist, don't even try to experiment. You won't just damage your tooth or enamel, you'll irreversibly ruin it, and then you'll have to get fillings and somehow restore the tooth afterward. And in conclusion, speaking about all these trends, of course, for the average person, it always looks very interesting and even tempting, and you always want to say, wow, it turns out you can save money here, and here you can do it yourself. But I actually want to address each of you. You are all specialists in your own fields, and if you put yourself in this position and imagine, for example, a car mechanic saying, I'll fix my car myself, or, I don't know, teachers at school or parents saying, I'll teach my child myself, you'll immediately realize that it's just not possible. We are all specialists in our own field, so when it comes to health and dental health, I would still trust only professionals. Subscribe to the channel, stay healthy, and take care of yourselves.